Hello all, myself Dr. Harshal Ekatpure, consultant endocrinologist and diabetologist at Viman Nagar, Pune. Today is 14th November and today we mark the this day as a World Diabetes Day, and it is celebrated as World Diabetes Day to create an awareness about diabetes and its different types and the treatment modalities amongst the common people. Today, 14th November is also happens to be a birth date of Sir Frederick Banting, who invented insulin around 1921, 1922 with his help of his associates, Dr. Best. And in 1923, rightfully, he was awarded a Nobel Prize for the same discovery. It was a groundbreaking discovery because prior to that, there were no definitive treatment modalities available for the treatment of diabetes, particularly type 1 diabetes, in which patient used to become cachexic over a period of time and used to die because of diabetes related complication. So after 100 years of insulin discovery, still there are multiple myths around the insulin, multiple misconceptions about the insulin therapy. Insulin is one of the life-saving drug, and insulin is one of the drug of choice for the treatment of diabetes. Drug of choice means what? Whenever any person is detected with a diabetes or any person is informed to you that he is having diabetes, without asking any more question, one drug that you can administer is a insulin. So it is called as a drug of choice. Now, insulin is nothing foreign. Your body produces insulin. Only thing is that in a type 1, type 2 diabetes, the body's ability to produce the insulin is substantially reduced. In type 1 diabetes, it is almost zero. So that's why administration of insulin is very essential in type 1 diabetes patients to control their blood glucose levels. And in type 2 diabetic patient, to some extent, can be managed with the oral anti-diabetic medications, but at certain point of time, they also have to take the help of insulin therapy. Only problem with insulin is that it's a protein, it's a large protein. So the proteins cannot be administered orally because acid in the stomach usually tend to destroy these proteins. That's why it has to be administered via injectable form, and it is usually administered as a subcutaneous injections. There are different insulin delivery devices, pen devices via which insulin can be administered. The insulin, whenever given in a right type, in a right doses, and under the monitoring, always brings down the blood glucose levels, will always help in patients to control the blood glucose levels. But the initiation of right type of insulin for a right type of diabetes is very, very essential. So very misconceptions about the insulins or having poor knowledge about the different types of insulin is one of the reason that insulin has been villainized in a diabetes management, particularly in a rural or the semi-urban areas. So the purpose of the today's video is just to create an awareness about the insulin therapy in a diabetes. So whenever you get a chance, you can read about the insulin, discovery of the insulin. There is a small book called as a discovery of the insulin, and you can understand through different difficulties through which the researchers went to discover the insulin. And today it must be very painful for them to see that the insulin has been villainized in a way, or there are lots of misconceptions about the insulin. So read about the insulin, discovery of the insulin, and at the end of the day, I would like to tell you that insulin is nothing foreign. It is what is your own body produces. If a type 2 diabetes or a type 1 diabetic patients take it in a proper manner, in a proper dosage, it's a best drug to control the blood glucose level. And in long term, it is very, very helpful in preventing the complications associated with the diabetes. With that, I wish you all a very uh, knowledgeable diabetes day. So utilize this opportunity to increase your knowledge in proper way about diabetes. Even if you don't have a diabetes, I'm sure many of your relatives could be having some type of diabetes. So increase your knowledge, get a proper knowledge with the diabetes, and with the help of proper knowledge, you can bring uh, improvement in a quality of life in you or your relatives who are suffering from diabetes. Thank you very much, and good day to all.